So it's 1:04 and we'll get started today. We have Colleen Nelson with us from Lake County Public Health Agency. Colleen, would you like to start with an update?
Nice weekend, enjoyed some of the weather. As we know, some of it was not quite ideal, but as some of you may know, the governor has made a decision about restaurants and day camps at this point in time. So yesterday, there was a press release that went out saying that restaurants can open tomorrow on Wednesday, 5/27. And so currently for public health, we are going through all of our applications specifically for restaurants. We're reaching out to those who haven't turned in applications at this point so that they understand what that process is and feel pretty confident that anyone who submits an application will be approved prior to tomorrow. Obviously, if someone submits one at 5 p.m. tonight, we won't see it until tomorrow, but feel confident that we can get ahead of that pretty quickly. So far, that's exciting. Just reaching out to some other partners, seeing what's happening in other counties. We currently do not have any active cases of COVID-19. I believe our last active, meaning that someone who had symptoms and was tested, was April 30th. So we continue to social distance really well. Social distancing continues to be a part of that, and we all need to be responsible for ourselves when we're out in public and interacting. The request still is for folks that are more vulnerable, including our older population and folks with underlying conditions, to limit their time out in public. We continue to encourage folks to get out as far as recreating and exercising, to do that safely as well. And yeah, and so we'll be working on a public health order. We do know the governor is going on at 1:30 today, so I might need to drop off at that point. Hopefully we're at a good point at that point. and kind of see what other direction that may or may not be coming. We continue to work on all the applications, including our short-term rentals, which includes hotels, motels, Airbnb, to be open on June 1st, and that's going smoothly as well. And obviously, if anyone has any questions, feel free to call us at Public Health at 719-486-2413, extension 2, and or an email to environmentalhealth@co.lake.co.us. Thanks.
Thanks, Colleen. I see Dr. Lisa Zwerdlinger has joined us as well. Lisa, would you like to give us an update?
That was identified this morning, and another person of interest also.
Lisa, I'm sorry, we missed that first part.
I'm sorry. I just, unfortunately, we do have another positive case, that was reported out first thing this morning. And then we also have another person of interest. So, as we expected, when we have the lessening of our social distancing, there will be, times, unfortunately, when we, we do see an increase in cases. So let me get to my data. Would you allow me to share the screen, please?
Yep, we can see it.
Great. Okay, so Colorado is here. And so you can see the overall trend is down, which is good. And then these little peaks happen just because of weekend variation in testing. Obviously, less tests that are reported from Saturdays and Sundays. So when you collect the test, it takes a couple days for it to get back, but that's what these little blips are. But the overall trend is down. Looking in Colorado, again, there's the curve is a little more steep than it was before, but certainly not unexpected. The good news, as you can see here, is that the overall hospitalization data from Colorado continues to trend downward. So again, this blue line is current hospitalizations. And if you look at usable critical care beds, we are well within our safety margin. And then, the orange line, current hospitalized as of today. The green are transferred patients, so patients that exceeded the ability to be taken care of in their current hospitals. Again, the overall trend is down. And then the new admits for COVID, you can see, are very, very small. I think over the weekend, we actually had a 0% increase on one of those days where there was actually no reported deaths in Colorado, which is fabulous. Here is that graph, and I think whatever that was, the 22nd, 23rd, whatever, here's that day where actually no Colorado deaths, and we've just had a little tiny trickle, which again is great news when you compare us to where we were having 30 to 35 deaths happening per day there in mid-April. If you look at Lake County's data, again, it continues to show that trend. Here is our new positive case that we had this morning that was done 3 days ago. It took 3 days to report this one. Still no hospitalizations in recent history since the end of April, so we haven't had to admit a COVID patient here. And then our percentages, this number continues to decrease compared to the numbers that we saw, in previous weeks, where we're doing more testing, which is great. So our denominator has been getting bigger. And although we have that one more positive PCR RNA test here, the overall percentage is down 9%. I think it was 11% last week. So that means that out of all of the DNA tests that we're doing, less and less people are becoming infected. Or at least out of the total tests that we're doing, we're up to 620 of the antibody tests, and 20 of those have been positive. And so our number remains, at about 3% for people who have shown a history with the virus, so have had an exposure at some point to COVID-19. And what we're also learning too in Colorado is the more of these tests that we do, really excited about their accuracy. And there's a lot that's unknown, about COVID, but what we're doing now that we have, tens of thousands of these tests available to us is that they are pretty accurate. So we can rest assured that really it is still a small percentage of our population has been exposed and show evidence of infection. And then, of course, I really hope I get to continue to show this slide, which is that we've had no reported deaths for COVID-19. So, still the overall message is we're still doing great. We have clearly shown, a relative flattening of the curve. There is some, just get this out of the way. There is, that little peak there just because we had our one more positive test, and we had this lovely period of time for almost a month where we had no positive cases. But as more and more people come into our county, we can expect a little blip, and a little blip of one is great. So as long as we can continue that trend, I think that we're gonna be continue to do well. So questions about that?
This is Sarah Mudge. Did I, just a curiosity, Thursday I had heard that there were 5 out of the maybe 300, and maybe it just the numbers for the antibody tests that were positive. Seems like there was an influx either in reporting or more people getting that antibody test recently. Is that true?
Yeah, let me just show you that again. Where is that? So this is our daily test of the positivity, and if you look at the overall numbers here,
okay.
You can see that the positive numbers. I don't have. That's actually an interesting question. I didn't do the negative tests that we're doing, just the positive ones. But the number of the IgG tests are, I think, 80 more than it was last week. So I think it was 540, and now it's 620. So there were 80 folks who came in about, to get their IgG test. So yes, as long as as more people come in, the denominator, becomes bigger. But what's, again, interesting is this 3% has not changed. It was, 3.5% and then, 3.2%. But that 3% has not changed since we started following this in the past month. So again, it speaks to our inexperience with the virus.
Mm-hmm. Thanks.
Yeah. Any
Commissioner Glenn, do you have any questions?
I don't have anything at this point.
Great. All right. I'll stay on for a little bit longer. If folks do, though, don't hesitate to ask at any time.
I had a follow-up for Colleen, if I could, Commissioner Marcella.
Yeah, please go ahead.
Colleen, on the governor's announcement today, then, do you expect anything different than what was addressed yesterday? Or in addition to the guidelines put out?
I do, in the sense of, when he talked about, like last week, like, oh, I'm be talking about like these 6 things, and I've only heard, 3 out of the 6, and of course I can't remember what all 6 of them were at the time, but as we know, private campgrounds were able to be open, day camps can start June 1st, restaurants can be open as of tomorrow, were the big 3 that he didn't even announce. So I think there is going to be a bigger conversation, and I'd be interested to see, what the numbers are in the sense of where he's basing some of his data, because as we know, it's, most our data is like 3 weeks behind of the actions that we're taking, right now, today, if you will. So yeah, I am curious, because there's just a couple of pieces to see if he'll talk about some of the smaller operational pieces, if you will. That was not the best answer. It was vague, but I'm just, and to be honest, like, I'm just not sure, right? Like, you could say anything right now, because that's kind of been the trend.
Can I say one more thing I forgot? I got my first insurance denial this past week from a COVID-19 test. And we were, promised by the insurance companies that they would cover all of these at 100%. But there was a loophole that Bright Health found, which is the Summit County government public health insurance over there, where if patients are asymptomatic, they don't show evidence of COVID, they use that to argue that it was an elective test and not a medically directed test. So our insurance colleagues are being a little underhanded, but they are finding ways out of paying for these. And so the big plug that we put in for people that their insurance company was, supposed to pay for all of these things. There are some insurance companies that have found ways to not pay for some of these. So we have to backpedal a little bit on that, and that is the first denial. I will, of course, honor my promise and not charge people for those things that I promised, but we're going to have to now counsel our patients when they come in, either here or at St. Vincent's, that we can't promise that anymore.
Thank you, Lisa. I appreciate that. Colleen, I just have a couple quick questions before you go at 1:30. If you could update us. Has there been a reoccurring theme in the needs from restaurants as to what they need to open safely?
Yeah, so as you know, we've been talking with the restaurants, and, we've heard gloves might be an issue, thermometers might be, but there might be some workarounds, like making sure that folks have the ability to, if they can take their temperature at home and all those other things. So we are looking, decrease some of those needs, if you will, as well as like wipes, but now we're figuring out what solutions they can use and rags they can use and how to use it versus like a Santa wipe, if you will. And so that's kind of where we're at, and we continue to ask, but we don't have anything formalized in the sense. Becca did push out to all of them to kind of let her know, and so far we haven't had any direct inquiries to say I need X.
Thank you. Have you, and then has there been any guidance issued to those restaurants about their readiness, or will we have somebody from public health checking on them in person prior to their opening tomorrow, or how is that going to look?
Yes, so we do have Jackie Littlepage is actually walking the avenue today, and we do know who has applied and who hasn't. So she's checking in with all of the restaurants as she makes her way through to see where they're at. and answer any questions they might have for reopening, and then also talk to the ones specifically that haven't applied yet, if you will, to make sure that they know that they're eligible and if they need any further assistance at this point in time.
Great, thank you. Go ahead, Sarah. Looks like you're talking.
Yeah, I was just, I know some of the questions or frustrations came in some of, I mean, the PPE or whatnot. So I'm looking at the guidelines from the state. It's, you know, it doesn't look like mandated gloves or hand washing are mandated. And are we being sure to, you know, I know Jackie had talked about a certain thermometer last week, but it doesn't seem like that's something that that would be a suggestion. And so are we being sure to kind of be careful about we communicate?
Right, it's more along the lines of a symptom checker. And so, you know, folks are aware, like I said, of what some of the workarounds are as far as that goes. But it does talk about having the ability, and I don't have them up in front of me, and I don't know that I'm going to be able to find it as fast as you currently have them.
Do you
but
want the state?
there is a piece that talks about the ability to take temperatures, but I'd had to find it. Well, like I said, we are working with all businesses, and we're not going to deny, you know, a business to open if they don't have a thermometer on site.
Which, can you see this screen? Is this what you were looking for, Colin?
I cannot.
Oh, you can't see the screen?
Let me see. Hold on 1 second. It's way too small. Like I can't read anything on it.
Is that any better?
Not really. Yeah. If you want to give me a minute, I can find it as well. But I don't know if that needs to be a conversation in this meeting versus offline.
Well, I just want to make sure that if we, you know, we're getting those questions, we're reiterating the same approach.
Nope. I appreciate that.
I'll
Yeah.
stop sharing it because it doesn't seem to be helpful.
No, it's like really tiny, but let me, I'll put it up here in just a second. There is a part, but like my point is that we are communicating with them, and it's not, you know, a denial, if you will, in that respect. And so, and interesting, oh, doesn't matter. That's it. I'm like, and I have another whole interesting thing. So let me see if I can't get this.
Well, I think the PPE was a big concern, and if they don't, if it's not a must to get a certain thermometer or this or that, there are some, you know, we're chipping away at different accommodations that can meet kind of the intent and of the guidelines. And I feel like maybe right now I has that kind of question mark on requiring patrons to wear masks if they have enough disposable masks to hand out, or, you know, whatever that might look like. But I think possibly only time will tell how compliant and what kind of issues restaurant owners run into.
Yeah, I agree. I think it'll be very telling in the next couple of days. But so under guidance for food service space, under guidance regarding employees, it implements system monitoring protocols, including workplace temperature monitoring and symptom screening questions where possible. So it is a where possible is the point. And so if they're able to do it, that's great. If not, let's figure out, you know, a symptom screening so that making sure that they are checking in with their staff.
Mm-hmm. Okay, great.
Thanks, Colleen. I would imagine that would be done kind of on an individualized basis per each establishment, right?
Yes, like they would be responsible for tracking it so that, you know, if there's recognition of, oh, somebody went home sick, we at least know what date it was, you know, what they were experiencing, that kind of thing. And so there are like logs and things, and there's lots of like little additional tools that their restaurants are able to use.
Awesome, thank you. The only other question I have before we potentially adjourn at 1:30 is a question around public guidance for going into a restaurant establishment. Forgive me, I have not read through all of the press release at this point, but has there been any guidance or a press release from public health of education out to the public around maybe contacting those establishments and making a reservation, or like best practices for re-entering into those establishments at this point?
Yes and no. So in the press release, it talks about the expectation of wearing face coverings. We can't mandate them to do reservations. They would have to take it upon themselves. So it's not like something that public health would be like, hey, call ahead for reservations, because some of them may not be prepared to do that as far as staffing goes. But we can add that to some of the questions we're asking, like, hey, would you like us to push?
Great, thank you. And then are there any topics specifically that we would like to address tomorrow in our business town hall?
I can't hear, or am I the only one who can't?
I can hear you, Colleen.
Okay, I wasn't
Yeah,
sure.
I
I
can
didn't hear what Kayla finished saying. Sorry, it cut out.
Oh, sorry, I may have hit mute before I was finished talking. I was just wondering if there was any specific topics that we would try to talk about tomorrow during the business town hall.
We don't have a business town hall scheduled for tomorrow. We were thinking, so the thought was that we knew that a lot of folks would be reopening and preparing. And so we'll probably have a lot more information, and we'll have one next week if we think that. And trying to figure it all out. And we didn't want to add one more thing onto businesses' plates for tomorrow.
Well, do we still have the evening town hall?
Oh yeah, we'll still have our community town hall at 6.
Okay.
Yeah, that's still there.
In terms of the community town hall, I'm curious how you're going to handle, the governor talked about a 50% opening number, but that seemed odd to me because everything seems like it would be a matter of footprint, not a matter of percentage. How are you dealing with the individual business owners, restaurants on that subject?
Yes, so we're actually having that conversation about, how many tables, how many folks they normally put in there, what does that look like? And it has to be, it's either 50% of occupancy or a max of 50, whichever is less. And so you have to have a certain amount of social distance. Limits the amount of patrons that can be in there. And I think of most of our establishments, like to reach 50 would be difficult just through, the social distancing piece, if that makes sense, like the requirement for tables. And so, we have been talking, with the restaurants, and there is an understanding of what that looks like. And so, yes, did that answer your question? I'm sorry, Mayor.
Oh, it did. I just see it as a problematic issue for you. That's all. Because let's say a restaurant, they're saying 50% or 50, and they only have footprint for 20 people. I'm being very hypothetical, and they're not going to like that very much in terms of how you deal with the actual number that can be in there. I just felt like it was, I don't know.
I understand. We definitely had, trust me, we've had multiple conversations around that. And basically, our intent isn't to be like, oh, if you can hold 20, you can only have 10. If they can do it responsibly, as far as the way the tables are placed and everything else, then it's not like we're gonna be enforcing like a 50% piece. It's truly how they can do it safely with 6 feet between patrons and tables.
Right. I just think it puts you in an awkward position.
No, I can appreciate that. A lot of these things put us in awkward positions currently, as you know.
Okay. Does anybody have anything else for Dr. Lisa or Colleen before they hop off the call today?
Thank you both.
All right. Thank you both for being here. We appreciate it.
Yeah, thank you guys.
And we will talk to you both tomorrow.
Yes, ma'am. Have a good day. Thank you.
Thank you. You as well. Does anybody else have anything for us right now in this work session?
Kayla, this is Amber.
Hey, Amber, go ahead.
Okay, sorry. I just wanted to let everyone know that I did order masks and I got a call today that they should be shipping today or tomorrow. So we should have them next week.
Great.
Thanks, Amber. I appreciate that. That's for our county facilities, right?
Yeah, so that's for the disposable masks only. And I have not been able to connect with Sarah's contact on the N95 masks yet, but I'll keep working on that. And then our bulk hand sanitizer order did arrive today.
Nice.
Wonderful. Thank you.
I had a question regarding the N95 masks, and Chris, I shot you this question in email, Chris Floyd. Do we, and I apologize if we've been over this, are we only if we call it requiring masks to be worn, not face coverings, we need to provide an N95? Is there suggestions in where to, not mandate, but I mean, can we just continue getting the disposable face coverings?
Hey, Sarah. Yeah, I saw your email and actually responded back to it. It really depends on.
Sorry, I didn't quite catch that.
Siri apparently thought I was talking to her. Sorry. I sent an email back that it's not a global answer, because if masks are mandated by virtue of the type of duties that an employee is doing, then yes, the OSHA requirement kicks in for N95. Now, I sent you a copy of their recent enforcement that they're relaxing some of those requirements in terms of, not only who has to have them, but whether you can use them more than once and all of that kind of stuff. So I emailed that over. And I think my suggestion was your department heads should know if their normal duties involve activities that would trigger the requirement to have an N95 mask. So I would ask for, and I'd given the example, perhaps road and bridge maintenance. Amber, if there's certain maintenance activities you're doing with the aquatics center or something, there might be a need to have those kind of masks. So it's hard to make a global statement as to where they're required. And I would suggest to get feedback from your department heads as to whether they feel any of their activities that they do would trigger that requirement. Otherwise, it probably isn't a bad idea to have some in stock if there are such requirements, to make sure that those departments have what they need. But without that, then again, my recommendation is continue to refer them to as face coverings and provide disposable versions. Will be fine in terms of compliance with that.
Okay. Thank you, Chris.
Thank you. I appreciate it. Commissioner Glenn, do you have any questions or anything to add?
No, I don't have anything.
Okay, thank you. Commissioner Mudge, do you have anything else at this point?
No, I don't. No, thank you.
Okay. All right, everyone, we will reconvene tomorrow afternoon for a work session. I'd like to have an opportunity tomorrow to talk through some budget priorities and goals for the Board of County Commissioners tomorrow. Our assessor would like to talk to us as well a little bit tomorrow about requiring surveys and his needs in terms of mapping going into the budget season. So we can chat with him tomorrow afternoon at our work session as well. Thursday, I only have tourism vacancy appointment. I don't know if you have anything else for me to add to an agenda on Thursday, Sarah or Mark.
I need to, did we have the, oh goodness. Not right now, I'm sorry. I'll send you some items and we can either do that Thursday or next week.
Awesome, thank you. Michael Irwin, do you have your hand raised?
It might be it, but I need that U.S. Forest Service agreement. for the extra Schedule A work on the stuff down in Twin Lakes, around Twin Lakes, the roads and parking lot?
Okay, we can put that on Thursday as well.
Okay.
Great. Does anybody else have anything at this point before we adjourn today? We'll reconvene tomorrow afternoon at 1 p.m. Okay. With that, we will convene tomorrow at 1 p.m. Thanks everybody for being here today. We appreciate it.
Thank you.
Thanks.